Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Please see important safety information at the end of this video and full prescribing information at www.gvokeglucagon.com.
When I was 17 years old, I was at the diabetes conference, and at the hotel that we were staying at, the convention center, at the same time there was a karate tournament for kids worldwide. There was a teenager or preteen who was diagnosed with diabetes there on the spot. One of the teen leaders chose me and a couple other people to go and speak with him and the family in the hospital, and I was the first one to go in to talk to him and his family. That was when I realized, this is what I want to do. I don't care about anything. I made a difference. My goal every day is to make a difference in one patient. I've been in their shoes, my family has been in their shoes, and the first thing anybody needs to know is you're gonna be okay. As a person with type 1 diabetes, as someone who educates people about diabetes, I am more than just telling them what to do. I have some street cred too that can back up what I'm explaining. The first time I had a severe low, I actually had a hypoglycemic seizure. I was 15 years old. I don't remember too much of the typical low symptoms of feeling hungry or a little shaky. What really stuck out to me is having blurry vision, like I could look right at you, and it felt like my eyes were just going back and forth like this, and that was the last thing I remember before passing out. After that first severe low, it made me kind of accept and understand my vulnerability and that I always had to have a plan moving forward. Now I work for a continuous glucose monitor company. I educate healthcare providers and their staff and make sure that they know how to train their patients. You can think that when you have the right technologies, you can prevent lows altogether. But the truth is, when you take insulin, the more at risk you are for going low, and severe lows are possible. It's important to make sure that you have the right tools on hand for if something happens that is not expected. For me, it's important to have Gvoke. Lows are a normal part of diabetes. I typically treat with gummy bears or juice box or something fast acting.
You okay?
But sometimes that's not enough, or sometimes when I'm having those severe lows, as my experience shows, it's important to have Gvoke as well. I take Gvoke with me wherever I go. I think of Gvoke as my safety net because if something were to happen that's unexpected, I have it there with me. There's a lot of thoughts and fears that go around severe lows. Whether it's self-administering or somebody else giving it, I think the biggest misconception is having to wait. Another misconception is going to be, that'll never happen to me. I was someone who thought, that can never happen to me. You never wake up one day and say, I'm gonna have a severe low today. It's really important for all people with diabetes who take insulin and oral medications designed to lower your blood sugar to educate themselves on severe lows. As an educator, there's a million messages that I want to give my patients, but I think the most important ones are going to be, have a plan in place, expect the unexpected.
And then you're gonna hold for 5 seconds. You will hear a click.
I just care so much about my patients that I've worked with and making sure that diabetes isn't a barrier from making them live their dreams or achieving their goals. We always need to prepare to be safe.
Indication: Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Important safety information: do not use Gvoke if you have a tumor in the gland on top of your kidneys called a pheochromocytoma because of the risk of a substantial increase in blood pressure, have a tumor in your pancreas called an insulinoma because of the risk of low blood sugar, are allergic to glucagon or any inactive ingredient in Gvoke, Stop using Gvoke and seek immediate medical attention if you experience any symptoms of a serious allergic reaction, such as rash, difficulty breathing, or low blood pressure. Before using Gvoke, tell your doctor about all the medicines you take and your medical conditions, including if you have not had food or water for a long time, prolonged fasting or starvation, have low blood sugar that does not go away, chronic hypoglycemia, or have a history of a skin rash called necrolytic migratory erythema, commonly associated with glucagon-producing tumors. The most common side effects reported in adults are nausea, vomiting, swelling at the injection site, and headache. The most common side effects reported in children are nausea, low blood sugar, vomiting, headache, abdominal pain, high blood sugar, pain or redness at injection site, and hives. Inform caregivers on the instructions for use of Gvoke and symptoms of severe hypoglycemia, which include unconsciousness and seizures or convulsions. Store in original container until time of use and at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please talk to your doctor and see full prescribing information and patient information guide for Gvoke at www.gvokeglucagon.com.